Certainly in Tayside, our treatment programs through the needle exchanges have been instrumental, and if you look at where the heavy lifting's been done as you move towards elimination and reducing the burden of hepatitis C both on people affected by it and on the health services, it was through the community pharmacies reaching those people who are on opiate substitution therapy and through the needle exchanges, and that's where most of the patients who were in need of treatment were found and treated.
I first took heroin when I was 14 years old, and I'm now 46. It's been part of my life, my whole adult life. I don't know anything different. I'm scared, but I'll be lost without it.
You know, they just judge you by your appearance, you know what I mean? And it's so horrible, yeah, you know what I mean? And I think people didn't realise that just because you're on drugs, you've still got feelings. You know, they still hurt, like normal people, you know what I mean?
I couldn't get a vein because my arms were all bloated and I could have got an abscess. Luckily, touch wood, that I never got an abscess. So it was the caring centre that showed me how to inject safely, or I probably would have lost my arm or legs. I wanted to come to this place and I was made welcome. I wasn't made a second-class citizen.
We felt that it became more important to have our clinical nursing teams based on site with the third sector staff as well. It reduces any delays in people accessing their treatment, but also it's not just about their hepatitis treatment. And I think we always felt that there was a benefit to having that co-location, and we've replicated it in other areas across the rest of Tayside now as well.
That simple change of, instead of trying to get blood out of a vein and put it in a tube, taking it out of a finger and squeezing it onto some cardboard and being able to send it to the lab, dramatically changed who could do the testing, and that reach out of that movement of people into the community became very key.
People can access NHS nurses to do dry blood spot testing, or any of the staff actually in here can do dry blood spot testing, looking for hepatitis B, hepatitis C, HIV. We have an IEP service, so injecting equipment and paraphernalia. When they come in, a lot of the times they're like, Teresa, I would rather talk to you because I know you know how this feels, and I know that you've been there because I remember it.
Darren's a good example. Darren was someone who had never had a blood test for bloodborne viruses carried out before we started utilising dry blood spot tests in 2009.
Well, for me, the main reason for wanting to stay Hep C free and coming into the care centre is just to make sure I'm looking after my own body and stuff like that. And it's no difficult to come in and get that 5-minute routine check-up. And as I say, they make you feel like you're at home here.
Since he got his sustained virological response, he's been back at least once every single year to make sure that he remains negative, and he always has done.
And so the key change was the arrival of the DAAs, and that allowed us all the rest of the parts of the jigsaw puzzle to fall into place. We could then really effectively treat everybody relatively easily, and so that took away the last of the blocks and barricades.
The second time I got hepatitis C, Brian treated me with new tablets, and it only took 8 weeks' time. Every 6 months now, I get my blood test at the care centre, just to see what's coming back or going on.
So 94% of all patients who had a test in the needle exchange came back for the results, and 94% of the 28% who were positive for hepatitis C antibodies came for a follow-up appointment with myself. So in any walk of life, that's a really engaged population.
I would say I've had Hep C 3 times now. If I was to have a test done for my Hep C and that, I would rather wait for Brian and that. If no, I'd take me to the very last minute until I had no choice.
Community pharmacists, you can walk in the door and nobody knows why you're going there. So you could be going there to buy a toothbrush or shampoo, you could be going to get your methadone dose, you could be getting needles for your injecting drug use. Even a small pharmacy in Tayside would have a footfall of at least 1,500 different people a week. So 97% we worked out of our population would use a pharmacy at least once a year.
Lauren as a pharmacist, amazing. She's very approachable. She makes you feel like she goes the extra measure to help you get to wherever you want to go, and that matters.
So once we've found out somebody's positive and they've had their bloods tested and we've requested a prescription, it's usually to us within a week and we can get the medication started. So for example with Scott, he would be coming in for his methadone daily, so we would be giving him his Hep C treatment daily supervised, and he would take it in the pharmacy and just take his Sunday's dose home when we're closed.
My treatment was all done through the pharmacy. None of it was through the hospital. The tests to the treatment to the results, everything, it was all really good. It was Lauren that told me that I'd got rid of it. Just happy, yeah, I was really happy.
So we've been testing and treating for Hep C now for quite a few years and just try to put it in as a normal part of our practice. So any new patients that start with us will want to check if they've been tested within the last year, and any patients that continue on with us we would do every year, this just to make sure they're clear.
It makes sense to offer it at the chemist because you're there every day anyway. And contrary to popular belief, users do have a busy life.
The opportunity for an individual to access testing wherever they may be, so whether it's in drug treatment services, the community pharmacy who they've got a good relationship with, the needle exchange, ourselves at our clinics, it's about making it accessible as frequently, as often as we possibly can.
But elimination is not, a single point in time, it's a state of being. People who are most at risk of hepatitis C have many other challenges to their health and well-being, and it's about addressing all of those. And reinfection is one of those risks. And if you're not seeing people for retreatment, you're not reaching the populations you need to reach, because reinfection is a reality that will happen.